Welcome to the Anatomy of Inequity, a podcast that examines how systems, structures, and history shape health outcomes long before a patient enters the clinic. This podcast is designed for healthcare students and professionals who are willing to look beyond individual behavior and examine the conditions that produce unequal care, because outcomes aren't accidental and inequity has an anatomy. Welcome to the next episode of the Anatomy of Inequity. I am here with some special guests, and I am just really excited to talk to them. These are some of my former students, and they have been out and practicing in the field for a year or so. And so I thought it was really important for us to kind of come together, and I wanted to check on them. But more importantly, I wanted to talk to them about their experiences, kind of maybe a little bit about school, and then how those experiences have transitioned into their work life, and just get to know them a little bit better and see if they can encourage other people that might be coming on behind them in this field. So I'm going to let them introduce themselves, and then we'll get started kind of with our little conversation. So go ahead, Zavien.
Okay. All right, my name is Zavien. I work in the outpatient setting at 2 different clinics. Some interesting stuff about where I work is one clinic is so far away that I have to take the train 3 times a week. And then something else is I work next door to a Starbucks.
Okay, so we're supposed to be deciding which is not so truthful, which is true. I think you work next to a Starbucks. What do you all think? No?
I think it's next to a Dunkin'.
Yeah, I think he takes a train.
Please tell us. Yes.
I do work next door to a Dunkin', and both the locations to Starbucks.
Oh, okay, so you don't take the train, but
No.
See, I was right there, right? All right.
The Dunkin' though, next to it, but yeah, both locations got a Starbucks next door.
Gotcha. All right, all right. So Zavien is working at outpatient. Okay, Miss Candace, your turn.
Hello, my name is Candace. I work for a skilled nursing facility and long-term care. I work with patients that have different types of health conditions, and chronic and subacute, and I work with newborns.
Oh, I think I know. So we're supposed to figure out which one. Does she work with newborns? All right. Right. She kind of told on us when she said skilled nursing facility, right? All right. Well, Candace, thank you so much. All right. So now Daisy is up next. Yes, it's you, darling.
Daisy, and I work in outpatient, but it's a part of a hospital. So about my clinic is that, 2 things.
Yes.
One is that our therapy gym is in the basement, and 2 is that we just got a new pool chair.
I'm going to be quiet since that she's at her place of her clinical and I've been there, so I won't guess.
I don't think the gym is in the basement.
Yeah, I don't think so either. It's not in the basement.
You didn't get a new pool chair.
Okay, it's in the basement.
All right. No pool chair for them. All right, finish this off, Mary.
Hi, my name is Mary. I work in outpatient sports specific at a university. Something interesting. I work with a patient he's like 30, living the dream, basketball, don't give up. And I work with a lot of athletic trainers, maybe like 4 or 5.
She made that kind of hard, didn't she? So you work with an athlete that's 30? Is that what you're saying?
No.
Okay, I'm going with that, but I don't
Yeah,
know.
I'm gonna say that one.
Yeah, me
This is
too.
the second one.
I work with athletic trainers. I do not work with a patient who's 30.
What? Hey.
The oldest, like 25.
All right, so then we've got good representation, mostly outpatient, but got skilled nursing facility and some different experiences as well. So I'm just really excited for you all. I just want you all to know again, if I've never told you again, how proud I am of you. And the biggest conversation, or the biggest I guess piece of advice that I can give you all at this table is you have earned the right to have autonomy over your job and your life. And so whatever you decide to do, whether it's stay with the company that you're in or move on,
It is okay. It is your right. You have worked hard and you've earned that right. So with that being said, I want to talk a little bit about the transition from you being a new grad and then getting your license and now working kind of almost all of you all of it will be a year maybe or so in July, August, something like that. So tell me, anybody can jump in first. What was the experience? Was it a culture shock? Was it like, oh my gosh, or did you have some reality of what was going to happen because of your previous experiences? So anybody can jump in.
Yeah, I had a little bit like a idea because I was a tech before and an outpatient, but it was still like a culture shock. Just had like the pace and stuff. It was so fast paced, but it was like half and half. I was kind of ready, prepared, and still shocked to this day.
Okay. And do you think that the challenge that you had with that, was it because you had already seen so many things happen a certain way as a tech, and now you've got to look at it from a different lens, and so you're like, I didn't know why they did that, and I really don't understand it now, and I have some theory behind. Talk to me a little bit more about that.
Yeah, kind of like what you just said about like you see stuff that you used to see, but you didn't know like why, and now I'm kind of like dealing with it. So, um, yeah, just like for the most part, I would say like for me personally, I have to like double my schedule sometimes. Like right before my break and then after my break, I didn't know like why they used to have to do that, but like now I know because that's like the best time to do it instead of like the middle of the day or something like that when it's a rush.
So explain that to me. You're saying you give yourself enough time for documentation at the end of your, I'm not understanding. Is that what that is? Okay.
Yeah, like if I was to double my schedule, like I feel like from my last appointment or something like that, then I'd be there like all night.
I
Because I
got you.
got two patients at the same time about to leave and stuff like that.
Okay. Okay. So you're learning some crafts, some of the things about the craft or how to
To
set up
just like
things.
save time and stuff. Yeah.
And that really has nothing to do with physical therapy, right? It's about maintenance.
Time management.
Absolutely. Absolutely. Anybody else? Was the transition easy? Were you like, oh, this is what, did I get into this? Is it what I wanted? Anybody can talk to that.
Well, I could say when I first started, I was kind of nervous on my first day, but as time went on, I gotten used to things. Like my first day, I was asking like a lot of questions because I just wanted to make sure that I'm doing everything correctly. And on my first day, they actually gave me a full caseload.
Oh my.
So my director, she only worked with me just for like a couple of hours, and then she left me by myself. I was kind of nervous a little bit because it's my first physical therapy job because I was working as a CNA, and I felt like that helped me also because I have good patient care skills, and that's very important too.
Yeah. Yeah. So let's speak to that. So did you feel like that was okay for them to leave you like that? Do you feel like you wish that had been a different experience? And now that you've been there a year, if you saw that happening to someone else, how would you help them to be different?
Well, I felt like they, especially like on the first day, they should not have gave me a full caseload. Maybe see just a few patients and have me work with another PT just to see how they're working with the patients instead of me just being by myself. I mean, it was good that she was there so I can ask questions and stuff like that, and if I needed help, but I just felt like they shouldn't have did that.
Yeah. It's something I've learned in this field. So speech therapists, I don't know if you all know this. So speech assistants, they get their bachelor's degree and become speech assistants. And then they go back to grad school to become speech pathologists. But then they also have to work another 9 months, like a clinical CFY year, clinical rotation, where they're still supervised by someone. So it's almost like an extension. You're getting paid. You're not getting the top dollar, but you're getting paid a certain amount for 9 months, but you're being supervised. So like these people have to intentionally come and check your notes and all that kind of stuff. I kind of wish we had that model so they might stop some things like that. Because we don't have any once you get your license, you really are open to, and you have to be able to fight for yourself and say, okay, I know this is not right here. Yeah. Anybody else want to speak to that? Like your experience from transitioning from school to?
Another thing, I'm the only PTA in there and my supervising PT. She's there about twice a week just to do the evaluations and like progress notes for the Part B patients. But I do progress notes for Part A's.
Okay. Okay. And you again, it's a matter of speaking up for yourself, because a lot of times we were talking about this when we were together last. I don't think a lot of us really read our contracts the way we need to. And then the expectations are one way. And what I've learned, especially after leaving the institution that I was with you all, you have to read those contracts. I just was in contract negotiation for one of my jobs, and I sent the contract back 4 times. And at first I started feeling some kind of way, and I was like, no, I need this to say exactly what I needed to say so that I'm accountable to it, but that they are accountable to it too. Because I got that thrown back in my face so much. What does the contract say? Or that's not in my contract. Well, my students need this. I don't care if it's in my contract or not.
That's what people was telling you.
Sure. Oh, yeah. People. All right, let's move on. Okay. So now, anybody else? Nobody wants to talk about that. So now, once you've been on the job, now you all are in different settings, but pretty much you all are in outpatient settings, so to speak. What has it been like to be involved with patients and how they perceive you? Like, do they say, oh, you're just a new grad, you don't know anything? Like, or do you feel respected by your patients? Or talk to me about that. And your staff. Do you feel like they kind of minimize you and like, oh, you're a freshman, you got to figure it out? Or, kind of hazing, if you will.
Well, I feel like I don't work with many people. And since who I do work with, we're the same program, it's pretty simple. And yeah, the respect came.
Okay.
And then as far as patients and stuff, I feel like because I'm closer in age with them, they just kind of gravitate towards me and build that relationship a little easier. That's it.
You like your patients, Daisy?
I think they're all really cute because they really see us as like the educators for them. So they're really attentive. Even when I'm educating them, I feel like I'm in class again, explaining what we just learned. But it's cute because they all really take it in and they're really grateful with like the knowledge that we share with them. And then the coworkers, I mean, I think they're pretty good too. But I think there's a few of them that still see us as like a little like younger, like they'll be like, hey kid, I'm like kid.
How do you handle that? You just joke it off, or do you go get whatever they say?
I think there's more behind it. But some of them are pretty helpful. Like, because there's always PTs there, so sometimes they'll go over like anything that I want to practice more.
So you felt like with the staff that you got some mentorship, that you have felt supported in that way.
Like, sometimes manager will ask like the newer, like we had 2 new PTs, it was me and another girl, and she would post aside and say if there's anything we want to like learn more on that they do there. She set some time aside with like a PT who specializes in that. And then we kind of practice with them a little bit.
Nice. That's nice. I think it's so important to feel supported by your staff. It helps you to grow because you're not unsafe, if you will, right? You can, if you think back in school, the times where you felt safe and the times where you felt unsafe and how that made you feel as a student. That's how your patients feel, right? If you're not making them feel safe and feel like you can help them, then they have issue with that or they're on their guard. And that's the same thing that happens with you all because you all are still in a newer position. And people will do as much or as little as you insist that they do for you. Right? Yeah. Okay. I like that. One day, Daisy, I wanted to ask you one more question about the facility. Most of the patients that you see, are they coming from an inpatient setting to outpatient? I know a lot of shifting has been happening where people are getting discharged from hospitals so quickly and stuff like that. And you can talk to that with your skilled nursing stuff. Are they being discharged from the hospital early and coming to you all, or what's the makeup at the hospital?
It's mostly people that are just having pain, so they're coming straight from home.
Oh, okay.
Yeah, some people are a little fresh from like knee surgeries, but like so we've had someone come in like the day after their knee surgery. But most people just come from home with pain.
Okay, so that I wonder. So our are patients transitioning to rehab and skilled for nursing facilities at the same rate? Are you have a full caseload? Are you all over?
Actually, right now, no. The census has been pretty low. I only been working about 6 hours right now because yeah, the census has been low. A lot of patients been getting discharged going home, and we get the Medicare A is the skilled patients that come from the hospital, and we get some of them, but I guess like around this time, it's like we're not getting as many. But a couple months ago, like in the winter months, we had a lot of patients. Like it was times I was working about 9 to 10 hours a day.
So you're seeing some swings up and down. Does that happen with your athletes too, Mary? Like, do you have times of up and down, or is it always up? Do you go from season to season? Or are you focusing just on one sport?
Oh no, all sports.
All sports.
All sports. Sometimes it is a little slower because you really are unfortunately waiting for like athletes to get an injury. But I would say it's more up than slow though, because they're still coming in from stuff that they may have gotten surgery like 2 years ago, and then they're still having problems with it because they did return to play and then like hurt it. So yeah, I would say it's pretty more up.
More up. Okay. And how big is the university that you're tied to? You know, the athletic teams are they relatively big?
Yeah, they have like a team for everything.
Okay.
Men and women.
Okay.
Everything. Anything you can think of.
Okay.
Hockey, tennis, golf.
Okay. Okay. Yeah. So you're seeing all kinds of injuries and wow, interesting. So what's your top injury or not injury, but diagnosis that you see, Xavier?
Probably knee replacements.
Knee replacement.
And then just like stuff from car accidents like neck pain, low back pain.
So
sciatica.
Okay, so I'm going to ask you the same question I asked Daisy then. Are people because my understanding is that people are being discharged from the hospital like day after surgery, day of surgery, and then the expectation is not to go to skilled nursing, but to go home and then try to go to outpatient service or home health. Is that what you're noticing is happening?
For the most, it's like half and half. Like some people are getting like home health for like maybe a month and then they come, but then some people just come like 2 weeks after surgery.
Okay, so it just varies. Yeah, wow.
And then you can like tell the difference of like who's had home health and stuff, and then like just the new, just their first time ever having therapy type people. So
it would seem to me that physicians would be a little bit more, I don't know how much more insistent that they would be with going to rehab. Like there are so many studies that suggest that movement is the answer. So how do you perform this thousands of dollars surgery on a patient and then they just go home? You know that they are not going to move their knees on their own or their hips. It hurts too much. And I think I just don't know. It just seems like there's so many crazy things going on.
and they be like way behind. The people that just been sitting at home for like 2 weeks or like a month, they just be behind.
Yeah. And then we're supposed to be miracle workers.
All right.
Okay, I want to shift this a little bit. Let's talk about continuing education. So you all have been out a year. I know you haven't had to renew your license yet or anything, but what are you all looking for in terms of continuing education? Are you thinking about any certifications? Are you trying to do anything and I'm not saying that you should be. I'm just curious about what your jobs offer in terms of continuing ed, and if you are ever interested in any type of other additional certifications. Anybody can answer.
I think my job, I was thinking about doing something more, like I said, just geared towards the like cervical area, because that's what we see a lot. And as far as like the support they give, they just give us like hours every pay period, a certain amount of hours and dollars to help pay for it.
Any other your companies offer continuing ed?
People come and like talk to us, give us a class about above the knee amputations because they had like prosthetics and like what to do if we see different like gait deviations with their device.
Okay.
And we got hours for that if we signed up for the class.
Okay. All right. So your job is doing a little bit either.
Mm-hmm.
Okay. Was that a part of anybody's contract?
Yep.
It was.
Yep.
So are you looking forward to it then?
They told me that they offered it, but then they never sent the information.
Okay. Well, look.
You got like pay for it yourself?
No, they said that we get free continuing education with, I forgot the name of the company. But they
Oh,
said that, and then I never got it. Even my boss, she said she never got it either. And she's been there for 2 years. So
well, look, there's a new sheriff in town, so you better circle back in regard to that. So nobody's jobs right now are offering membership to the APTA or anything like that. Okay. So the reason why I'm saying that is that might not be something that you're interested in now. And I certainly have been in this game 30 years, and there were a multitude of years where I was not involved in APTA. But I do feel value in it. So I want you to kind of put that in the back of your head because it's kind of important as you are wanting to move and change. It's just a good source of networking. And I used to think it was like not worth it, but especially when I moved into higher ed, it's been a really nice way for me to kind of get acclimated. Okay. All right, so then I'm going to ask this kind of one kind of thing to see if we could roll the tape back, and this was May 2025. Let's say May 2nd, just because I know you all hadn't graduated yet. What would you be telling that person now that you've been out a year? So we're rolling it back before graduation. You're all nervous about whatever, or you were happy to be done, or whatever the case may be. Now you've been out almost a year. What would you tell that Mary or that Daisy or
Read that contract.
Yeah, amen. Read the contract and amend the contract.
Don't take a comfortability.
All right, very good, Eric, very good.
I would tell them to start off as PRN first, just to see if you may like it or not. If you don't like it, you don't have to go back.
All right. So keep your options open. Read your contract. All right, what you got?
I would say see your more options first.
So you feel like see more. So don't just take the first job. Is that what you're
Yeah.
saying? All right. Okay, I like that. All right.
You probably just read the contract.
I feel like somebody told y'all to read the contract. All right. So this episode has really kind of been a catch up with some of my favorite people in the field, and I appreciate that. I do want to tie this though to inequities because this is really what this podcast was developed for. We end up not getting all that we deserve in life or in our jobs or in our careers, basically because sometimes we just don't know what we don't know. And so I think the valuable lesson that I heard from these newbies in the field is that you have to be intentional about everything, and nobody is going to take care of your professional self better than you can, right? So always seek higher. I know you might be tired, like I'm not thinking about school. But you all, especially at this table, are bright and you're curious and you're going to want more. And so don't ever put those things back on the back burner of wanting to teach or wanting to go back to get your DPT, whatever it is, you can do it. And it's okay to rest for a minute, but just keep on going, because if you don't, there are inequities that you're going to run into that you don't like, and you're going to feel stuck again. And I don't want you all to ever feel like you're stuck again, because you have some paper that says you don't have to be stuck. And I know right now in this country, our papers, our licenses don't mean a whole lot to a whole lot of people, but you earned it and you know what it means. And so we will get through this wave of craziness that we're in 2026, and you want to have your papers ready. You don't want to have to, what do you say? You want to stay ready so you don't have to get ready. Okay, so we're going to end this session or this episode here. I appreciate my friends coming to hang out with me, and I wish them all the best. All y'all say bye-bye.
As you move forward in this course, remember this: health disparities are not simply about patients, they're about systems. And as future clinicians, you don't just treat bodies, you practice within structures that either reinforce inequity or interrupt it. Reflect on how this episode connects to student learning outcomes and how that understanding may influence your clinical perspective. This is the Anatomy of Inequity,